Hi everyone, welcome back to Wellness Podcast, and our today's topic is knee replacement surgery or total knee arthroplasty. And my today's guest is orthopedic surgeon Dr. Juozas Belickas.
Hello.
So, doctor, can you introduce yourself just a little bit about your career and why do you love doing knee replacement surgeries?
Okay. So I'm orthopedic surgeon for about 30 years. So my way to become orthopedic surgeon was quite long. I was studying in the technical university, mathematics and engineering, and at that time I had a trauma, trauma of my knee, and I had very big problem with the knee for about 1 year or even more. So I started to show interest in anatomy, in medicine, and I thought it's very nice specialty, like to be a surgeon or to be a doctor. So okay, but I was in about fourth year in technical university. So I thought maybe I will finish this university, and after I will go to medicine, and I did so. So I graduated from technical university, and I became engineer mathematician. And after I entered medical university, finished it, and I decided to be a surgeon, and I became orthopedic surgeon.
So let's talk just a little bit about normal knee anatomy, like short description on how normal knees work and how a person might find themselves needing knee replacement after a while.
So a knee consists of two big bones, a femur and tibia, and one additional bone is on top. It's patella. It's eliminated from this maquette, and two bones, and there are some ligaments inside the knee. There are two cruciate ligaments, on sides two collateral ligaments, and also patellar ligament and quadriceps tendon ligament. And knee is working like flexing and bending. Also have some rotation and some sliding. Mm-hmm. So main biomechanics is like this.
You are the surgeon in Lithuania and your patient is living in the UK, Ireland, Canada, or etc. What kind of documentation does the patient need to come to us and have the surgery? Do you need an X-ray? Do you need other kinds of, general practitioner forms? Just walk us through the process.
Yes, the main thing what we need is X-rays of the knee. It's better to make X-rays in standing position.
Yeah.
Because in this position we can see the best view of the leg and of the knee. Mm-hmm. So main thing is X-rays.
Yeah.
And after we can discuss if this patient needs arthroplasty or not. Mm-hmm. So and we don't need MRI in many cases. It's enough X-rays, and also some report from a general practitioner. And just before surgery, when we decided that patient needs surgery, they need to make some blood tests and send us.
I think we can also provide these blood tests at our clinic as well.
Yeah, yes, as well. It's not a problem. We always do blood tests. Mm-hmm. We repeat blood tests in our clinic, and also we always repeat X-rays for the patient.
Okay, understood.
Just to decide finally what kind of prosthesis patient needs.
Okay. Prior the patient's actual visit into the hospital, can he have an online video consultation with you?
Yes, if he needs, yes. Yes,
So
we
he
can,
can
we can
get
make,
to know
yes.
each other and you
Oh,
can
yeah.
talk about the case
Yeah,
and
sure,
so on.
sure.
Okay, so patient preparation for surgery. What kind of preparations do patient need to undertake before the surgery? When should this preparation start and what should it entail?
So preparation is just to make this blood test at home, just to see if a patient don't have some severe diseases, or and also a report from a general practitioner, and that's it.
And after our rehabilitation program, the physiotherapist is working individually with the patient. So, from what I've seen, the patients are completely, fully capable most of the time to anything really. I mean, the daily life activities. I'm not saying that they should play rugby or something like that, but they can stand up, sit down, walk up the stairs and down the stairs. Yeah.
Yes, it's true. Yes, so they can climb stairs and even drive a car and
Yeah.
yeah, and walk and uh, all all simple daily activities and even more.
What type of anesthesia is used during knee replacement surgery?
Usually we use spinal anesthesia. It's not the same as epidural because many patients asking about now I will have epidural anesthesia. Maybe understanding is a bit different from the patients. They think that it's epidural, it's same as spinal.
I thought that as well, actually.
Yeah, so you should know that we use spinal. Spinal, it means you don't have any catheter in your spinal canal. So it's only injection of medications to your spine canal.
But the effect is the same. You don't feel anything from waist down?
Yeah, you don't feel anything. Yes, starting from your abdomen and down, and during surgery you can sleep, you can listen music, you can talk with a doctor, anesthesiologist.
If I don't want to be awake during the surgery, I can be put down under.
Yeah, it's it depends on the patients. Mostly patients want to sleep
Yeah.
and don't hear anything.
Anything.
So they can discuss about that with a anesthesiologist. Yeah, but if there are some patients who want to listen music or some to see some videos, they can do it also.
Oh, yeah, because they are, well, temporarily paralyzed from waist down. So, and there's a curtain between the patient's head and between his
Oh,
body,
sure.
so he does not see anything. when
Sure,
he's
of
awake.
course.
What does the surgical procedure involve, and how long does it typically take? So, what is the methodology of the knee replacement surgery?
Yeah, so usually in total knee replacement, it's incision in front of the knee. It's quite long, about 15 centimeters. And we open the knee, soft tissues. And after we cut bones, according to damage of the cartilage of the bone. So we use special instrumentation, special guides, how to cut the bones. So we cut only this damaged parts. Like in femur, there are 5 cuts, just articular surface. And in tibia, we cut 1 cut only, like this. And after we use a special guide to measure size of the implants, because sizes of the patients are different, sizes of the bones are different. So we always measure size of the of the
But
implant.
you're doing the measuring during the surgery, not before the surgery from X-rays?
For the X-rays, it's we cannot say exactly. We
So
always
it's just a guide.
yes, we always measure size of the bone, and we have full set of probe implants.
Uh-huh.
So we always check what size is perfect to the patient.
Okay.
So yeah, and after when we cut bones, after we test with this probe implants, we test the stability and size of the insert, and if we like this situation, we like size of implants, and we are happy with stability, we remove this probe implants, and we implant real implants. So okay, now I can show you
Yeah.
okay, parts of the knee prosthesis. So as I mentioned, there are mainly three parts: femoral part. You put it like this.
Show maybe
Yes,
there.
it's it comes like this.
Maybe it's not the right size for us.
Yeah, maybe it's too big, but it's we always measure it.
Okay.
So it's on the femur and on tibia, as we cut bone over here. So we put this implant like this,
Yeah.
and this metal piece is tibial part, and this very hard polyethylene, it's called insert. So we put it on this metal implant.
Okay.
So movement goes like this.
Looks very cool, actually. I've seen it live. So
So this is total knee replacement, total knee implants.
can I try to do this because
Okay,
it
sure.
looks really cool. So do I put it like
Yeah.
this, and this is your new? It's actually quite heavy, the implant.
Yes, quite heavy because it's total knee. And sometimes we use routinely we don't use, but sometimes we use a fourth part of the knee prosthesis, patellar part. So, but it's not routine in Lithuania. In some countries, surgeons like to use patellar component routinely.
Okay, and this implant?
Okay, these implants are very big. These implants are revision, used for revision.
When
If
person needs to.
you need to replace former prosthesis,
Oh, the old implant.
so usually we have bone loss, so we need to use more difficult implants with the long stems or with some augments, metal augments, and so this is quite big. And
looks big.
yes, so this is revision components.
Purpose. So this goes straight into which bone? This bone?
Yeah, this goes to the femur, like
So-
to the tunnel, like this.
Okay.
Inside the, we can make total knee replacement with these implants, and in some cases we can make partial knee replacement. If we have only side damaged of the knee, for example, medial side of the knee, and other part other part is normal, it's intact, cartilage is nice. Problem is only on one side. So we can make partial knee replacement, and implants for this replacement are much smaller. it's only a small part of the femur, a small part on tibia,
Okay.
and inserted between them. So movement goes like this. Look, it's much smaller implant, and it's more anatomic because.
Can I try to
Okay,
do
please.
this? It looks very entertaining and very interesting. Yes, you can talk, doctor.
Yeah, and there are some indications for the surgery, like for partial knee replacement, and arthrosis only on one side. Other side should be intact. Cruciate ligaments should be intact, and collateral ligaments should be intact, and not so bad patellofemoral component. So compartment, sorry. But incision during the surgery much smaller. Everything more anatomical because cruciate ligaments stay intact, and rehabilitation is faster, and results are better than after total knee replacement. But it's only if this indication, it means only one side is damaged.
We are now after the knee replacement surgery, so let's talk about first 24 hours. What can a patient expect during the first 24 hours after the knee replacement surgery?
Pain at first. So we always have program for post-operative care about pain. So for at least 3 days, so we can manage with the pain. So, but mild pain can remain for these patients. So this is very important to manage with the pain. And 6 hours after surgery, we ask patients to start walking, to make the first steps. It's very important early mobilization. So, and they can bend the knee, they can use weight bearing.
So let's talk about the importance of rehabilitation. Why is good physiotherapy and rehabilitation important?
Yeah, the first mobilization is early mobilization is very important, and it's very important to start walking early, as I said before, and it's very important to get good flexion and extension of the knee, and other reason is to strengthen the muscles. So our physiotherapist can help to manage with this.
And it's also my knowledge that our patients who come from abroad, because the rehabilitation process, I wouldn't say is very different for Lithuanians and people from the UK, for example, but it's for sure Lithuanians do have a longer rehabilitation process because they live in Lithuania. And I think even like in the governmental side of things, knee replacement has like, I think, 18 days of paid,
usually 24 hours in a stationary rehabilitation center.
Yeah, and
24 days.
hip is, I think, less.
A bit less, I think 21 or 18.
21?
Yeah.
Okay, so yeah. But when our patients fly from the UK, of course, they want results in a short period of time. So the physiotherapist comes twice a day and works with the patient individually. We have many patient testimonials here on our YouTube channel, so you can see firsthand how everything goes and what kind of exercises the patients do and how do they look after 1 week versus 1 day after the surgery. So we managed to, like, with a concentrated and good work, both from the patients and physiotherapist sides, we really achieve a lot during like those 10 days or so. Doctor, let's talk about bilateral knee replacement, and is it possible to perform the bilateral knee replacements, replacing both knees simultaneously?
Yes, it's possible. Yeah, but the main thing when we can do that, patients should be very healthy and quite young, because one knee replacement is a big trauma. Two knee replacements for the same patient at the same time, it's double trauma. And after such a surgery, it's quite difficult to start walking. Some patients afraid for that. But if, as I said, if the patients are quite young and strong, and yeah, so.
So the advantages of this would be one, anesthesia.
Yeah.
I think to replace two knees at the same time would be cheaper than one knee and come back for another knee.
Just travel, just travel expenses. But because these patients are not cheaper, because they need more medications,
Okay,
more care, and so on. And okay, for me it's much easier because I can do two surgeries at once, so it's good for me. But for the patients, it's not so easy.
I think the patient has to keep in mind if he's a working person or not, because when the two knees are replaced, it's not the same as having like one knee replaced.
Yeah, but in some cases, if which is a good indication for bilateral replacement, usually our patients have big deformations, and if you make if they have a deformation like this, and we replace the knee, so we have straight axis of the leg, and it happens that this reconstructed knee is a bit long, not knee, sorry, leg. It's a bit longer. So it means other leg is a bit shorter. So it's very good if you can make both legs the same length. But it not for everybody.
Restoration of full knee motion is uncommon after total knee replacement. Could you elaborate on this?
Yeah, it is true, because design of the implants not allowed to make the full flexion of the knee, and it's limited according to design of the knee. But companies make better and newer design of the prosthesis, trying to make better and better flexion. Extension always should be straight, full extension, and the flexion sometimes, always, it's limited by design. So, our aim is to achieve about 110, 120 degrees of flexion. So it's quite enough for the patients. But some patients can do 130 degrees. To make more, maybe they can do with a partial knee. It's easier.
Okay.
Yeah. So, but it's limited.
Longevity of implants. So how long can patients expect the knee implants to last?
If prosthesis is implanted well, so prosthesis can be used for 10, 15, even 20 years. So if it's okay for normal implanted knee, it should last for 15 years at least.
At least. Okay. Recovery at home. What should patients know about recovering at home once they return after the surgery? When can they resume their regular activities? I think first part of the question we talked about in the beginning of our podcast. So when can the person expect to go to their regular activities?
Regular activities is walking, climbing stairs, and maybe driving the car, riding bicycle. So they can do that, I think, for some patients even after 1 month.
Mm-hmm.
Yeah. So this is daily activities.
Yeah. And when can a patient consider his new knee, his own knee? When is he fully healed? After the surgery, like 2 months?
It takes time. Yeah, fully healed. It's 2 months. It's no.
Too early.
Too early. Yeah. Usually half a year. It's maybe it's enough.
Mm-hmm.
But there is swelling even after half a year. Still can be knee can be swollen.
Yeah.
And even after 1 year. So 1 year it's quite enough for to feel the knee like normal or almost normal.
So, doctor, would you like to add something to the end of our podcast?
Oh, okay. I would like to say that this is big surgery, but don't afraid for the surgery because it helps for almost all patients if they don't have any complications. So don't listen your neighbors or others. Okay, if you have pain of the knee, don't go for knee replacement. Walk with this damaged knee because it's your own knee. So, but it's not true. You know, you should not afraid for the surgery because it helps for all patients.
Thank you, doctor, for your time. You were generous with it. I definitely learned something about total knee arthroplasty. And yeah, just thank you. And thank you for watching.
Thank you.
Bye.
Bye.